Dear students, we'll discuss a clinical case which may be useful in the, as a long case and sometimes short case, maybe a oxy case also. Just see, just see here, there's a scar here, and there is a mass here, and there is a bag here. So this is probably stoma. This is the mass. This is the mass, the vertical scar adjacent to the umbilicus. See that this is abdominal wall mass with the ileostomy stoma. Probably this patient, you can look at the scar that rent the scar. This patient has undergone laparotomy, probably has undergone resection in the colon. Probably we presume that anterior resection for rectosigmoid growth, and ileostomy was done as a diversion. And eventually, of course, patient might have had adjuvant therapy like chemotherapy, but later there is a recurrence. See that? Probably there is a recurrence, and probably in the abdominal wall. So how to confirm this is the abdominal wall mass? See that it's well localized, and on head raising or leg raising test, Carnage test, it becomes more prominent. On percussion, it is dull, and it may be mobile depending on the extent it is getting involved, and it's very close to the ileostomy. See that stoma is there, this is the ileostomy, and other possibility is infection because adjacent to the ileostomy, it might have formed abscess. So depending on the clinical situation, whether it is warm, fever is there, softness is there, tenderness is there, then you may say that it's a parastomal abscess. In such a situation, it has to be drained. It is not a recurrence. So you need to do CCT abdomen, you need to do colonoscopy, you need to do CEA. The recurrence is there, LFT you have to do, maybe PET-CT you have to do. Of course, if it's only abscess, you are happy. You drain the abscess, send it to the pus for culture sensitivity, and continue the antibiotic. But in this patient, clinically, this was very hard abdominal wall mass, and it turned out to be metastatic disease. So PET-CT has to be done. No treatment is only chemotherapy because it becomes a stage 4 disease, and nothing else can be done. You can't do wide local excision. There may be probably peritoneal mets also. Inside also local recurrence may be there. That may be confirmed by doing colonoscopy as such. So treatment is only chemotherapy. Surgical intervention is not possible. Other thing you have to think of is desmoid tumor, but it's less likely because there is a stoma here, scar here. If you correlate all history and also findings here, it's unlikely to be a desmoid tumor. And loop ileostomy, maybe to loop and end, commonly done for any colonic pathology. Usually it is done as a temporary one. Sometimes permanent ileostomy is done in a total colectomy cases. Ileostomy, long-term ileostomy is done for when you do a pouch after total proctocolectomy for Crohn's or ulcerative colitis, severe ulcerative colitis. And diversion ileostomy is done for after anterior resection for rectosigmoid or proximal proximal rectal growth to divert so that promote the healing of the anastomosis there. So, or any acute colonic conditions, maybe perforation, maybe wallus, sigmoid wallus, then you will do ileostomy as a covering one so that you close the ileostomy after 3 months and so on. So that is the exact requirement, or usually it is done on the right iliac fossa through the rectus muscle. Usually loop or end is done, and problems are it may go for stricture, prolapse, parastomal hernia, then bleeding, infection, and so on, skin complications. Colostomy bag taking care also important. So the discomfort, psychological discomfort also to the patient. But usually in a diversion ileostomy, it is usually closed after 3 months once things are settled, or after chemotherapy schedule in the malignancy. Usually chemotherapy schedule lasts for 6 months. After that, confirm that there is no local recurrence, everything is clear, patient is clear of the disease, then only close the ileostomy. So don't close the ileostomy in a hurry until you sure that things have healed well, and also make sure that there is no recurrence. So read my surgical service manual of surgery, current edition, chapter 40, 44, 45, where ileostomy in detail is there. There is a short note for you. And students, again, I request you to subscribe my YouTube channel, SRB Surgical Insight, and update your surgical knowledge with the daily lectures about different aspects of surgery for 8 to 10 minutes, like instrument, specimens, clinical cases, operative procedures, and so on, X-rays, instruments, and CT scan, and and also share with this YouTube channel with your friends, colleagues, and press the bell, and it will be very, very useful, so that without much time you can learn surgery daily. And once in 2 weeks you have got a live session with interaction. Students are presenting the case for around 1.5 hours, and where not only myself, with the other senior faculties will have interactive session. You can have interact with the chat box, and also will get a certificate if you join live session, so that it will be useful for your future career. So again, request you to subscribe my YouTube channel. Answer the MCQ. Raspberry tumor is A, B, C, D. Find out the right answer. I will appreciate and acknowledge your answer in the comment box. Answer another MCQ. Usual treatment for a desmoid tumor is A, B, C, D. Find out the right answer and acknowledge your right answer. Put it in the comment box. And the quotation of the day is, time for today's fitness, save the time for tomorrow's sickness. So if you fit today, tomorrow you won't waste your time for your illness to have a treatment or rest. So fitness and healthy fitness, which is very, very crucial, especially for surgeons. This quotation is very important. Students, again, I request you to have my SRB's Manual of Surgery current edition, which covers all oxy chapter, general surgery, gastro surgery, basic surgeries, endocrine, breast, thyroid, and briefly operative surgery, instrument, anesthesia, recent advances, with the quotations, with a lot of photos and illustrations, with the management concepts in detail, and it will be very, very useful for post UGs and undergraduates. According to the oxy, it is covered. So please purchase my third manual surgery and go through it. It will cover everything about the surgery, and also my clinical methods in surgery with video how to examine a patient, with how to examine a patient with the concepts, all chapters: general examination, breast examination, thyroid, vascular disease, venous disease, abdomen examination, urology, neurosurgery little bit, briefly orthopedic, and hernia, hydrocele, everything is covered. Only examination, but lot of photos with the concepts how to examine different things, which is very, very useful for a practical examination. But there is no management aspect, which also contains instruments, specimens, and X-rays also. Please purchase my manual of surgery, my operative surgery 2-volume edition. Is very good, extensive, and more than 10,000 illustrations. It's very useful, step by step. All surgeries from major to minor surgeries are there. It's very useful before going for doing surgery, especially for brain consultant and postgraduate surgery. Postgraduate is very, very useful. You can purchase that. My atlas of tissue approximation, it brief 100 pages atlas, which contains with the video. It shows how to do the tissue approximation, skin to deeper tissues, bowel, laparoscopic tissue approximation, proper principles, and how to hold instrument to basics. It is very, very useful to learner, to beginner, how to hold the instrument and other things. Please again have that book, and also subscribe my YouTube channel. The QR code is there. My beginner lectures through JP Publishers for 220 hours. Everything is covered. Instruments, everything, all oxy chapters, specialties, urology, cardiothoracic, and specimen, and neurosurgery, with all chapters, with the clinical examination, instruments, specimens, operative procedures. Everything is covered as for oxy. Around 220-hour lecture through JPs. It's very, very useful. Please purchase for 1 year before the exam, so that it will be very, very useful. Like when you listen to the lecture and have every knowledge about the surgery to face the exam as such. So students, I hope you understood this lecture very well. Thank you so much.